I think we should start. We have a critical mass of attendees. Um, Good evening, everyone. Thank you for joining us tonight. Um, Today we are going to be presenting on how to standardize surgical notes across your practice and give you some practical tips to do so. Um, I'm Isaac. I help run marketing for DSN, and Eric is going to be doing the bulk of the presenting and demonstrating tonight. Eric is one of our senior account executives here. So, Eric, with that being said, I will pass things off to you. Everyone, if you have questions, you should be able to post them in the chat in Zoom. Should be pretty straightforward, and I'll be monitoring that. And if it makes sense, I'll ask Eric the question. It's possible that we wait until the end, depending on the flow. But I promise I will look at everyone's questions and we'll do our best to answer them. So with that being said, Eric, I will let you take it away.
Thank you, Isaac. Welcome everyone to our webinar on standardizing surgical notes. For those who are new to DSN, we are an all-in-one practice management software designed specifically for specialty dental, notably OMS, periodontics, and endodontics. So today we will cover the common challenges we face without standardization, why standardization matters, steps to implement a system for your practice, as well as a practical playbook on how DSN can assist, followed by a short demo and opportunity for some questions at the end. So first, let's discuss the common challenges we face without standardizing for a typical practice. For note-taking, there could be varying dictation styles. Freeform notes can also be hard to read, inconsistent, and open to misinterpretation. This can lead to incomplete operative notes and even potential medical errors. Manual note-taking, especially when done after hours, can be very time-consuming and error-prone. Especially if you had a busy day at the practice, seeing patients back to back, you may have trouble remembering what has actually been discussed in the consult, therefore leading to billing delays, denials, due to unclear or missing documentation. So moving on to why standardization matters. It matters because it would not only resolve a lot of the common challenges mentioned previously, but firstly, it's communication. Having standardized notes allow team members to quickly and easily understand the patient's condition, treatment plan, and surgical events. Second is efficiency. Using standardized templates can significantly reduce the time spent on documentation, and this extra time can be reallocated for the team to focus more in other areas such as patient care. And last but not least, as a primary legal document, your notes will serve as a key tool for legal protection. If it's not written down, it didn't happen. Having standardized, complete, and contemporaneous notes will serve as indisputable evidence that the standard of care was met to defend against any allegations or malpractice claims, therefore highlighting the importance of the level of detail within your documentation. So what steps can you take to standardize your notes for your practice? Well, first, you would want to audit your current notes to identify areas of variability and recurring missing information. Next, we need to define a master template with inputs and feedback from different departments, and if there are any specific information they need to see. We will then pilot the template with 1 or 2 providers, gathering feedback and refining further. Once you are happy with the template, it's time to roll it out across your practice and train your users using a standardized approach. And then once implemented, monitor compliance, measure time saved, and impact on the relevant metrics, such as numbers of claims denial or number of time spent on the claims, whilst periodically reviewing performance and adjusting as necessary until you have an optimal template. And here is a practical playbook on how DSN can assist with standardizing. We offer defined formatted templates for notes and op reports. You will be able to customize phrases or templates to pre-fill notes based on procedure type or complexity. DSN can integrate with your vitals monitor for accurate documentation. Recently, we also introduced an AI assistant to help with note-taking, soon to be released to our cloud clients. Our integrated system can go even further in the spirit of standardization with easy generation of patient reports and correspondence to referring doctors. So let me show you a live demo on how DSN can help create notes in a standard format. So I'll go ahead and share my screen here. Now, for our existing DSN clients, this page, this screen might be familiar to you. I will be demonstrating how we leverage DSN to produce a consult note and then a surgical note. So here we have the EMR of DSN Cloud, and we have preset phrases from within the defined sections. The phrases are entirely customizable to your practice. And so for a consult note, we typically use the three main tabs: the history, the limited exam, and the full exam. There are multiple ways for you to begin building your note. So for one, you can click on individual phrases, and then that will build into the note. Alternatively, you can use the AI assistant to help you. And how the AI works is that we would have a microphone placed between yourself and the patient. And the microphone we supply will be similar to the size of a USB thumb drive, designed to be clipped onto your clothes, allowing it to be portable. You can dictate directly to the AI, or you can use the AI to listen passively in the background while you're having a consult with the patient. Regardless of the method, it will automatically enter the pertinent clinical information to the relevant boxes based on what it hears. If you use it within a conversation setting with a patient, it will also omit any kind of small talk from the note, so it will only enter the clinical information for the note. For the purpose of this demonstration, I will upload an audio clip to the AI, and this audio clip is a 4-minute conversation between an oral surgeon and that patient. So I will go ahead and upload this in, and you will be very shortly be able to see how it passes the clip and enter the information into the note. So as you can see, it will begin to enter the information into the boxes. And
Sorry,
within 10 to
not
15 seconds. Sorry, what was that, Isaac?
sorry. I don't know if we were supposed to hear some sort of recording, but we just saw it. We just saw it
There
there.
is no recording. The recording is pre-recorded.
Got it.
So once I've uploaded it, it will just listen to the audio clip within the AI setting, and it will automatically enter information in just like this.
Got you.
Alternatively, if you, last but not least, if you do see a lot of common cases and you tend to notice that most of your notes can be similar to each other, you can utilize templates to pre-fill the note. So if I select a template, it will give you a baseline to work out of. But regardless of the method you use, the final result will give you a very standardized template looking like this. You can see how it's all clearly sectioned out, allowing all team members to find information quickly or if anything is missing at a glance. Next, we can move on to the op report. And how we would train a DSN office to fill out an op report is we typically would ask an assistant to fill this out beforehand. So here we would select what monitors the patient will be hooked up to, the pre-op data, anesthesia, ASA status, airway class. Scrolling down, ignoring the operative part for now, we can then select the phrases for the procedure, treatment indication, surgical team, surgical description. Again, these phrases are also customizable, and I'll just enter some other information in just to fill out the op report. Okay. For medications, you can fill it in as you go along. So if we're adding 20 micrograms of fen, we can enter that in, and it will give you a timestamp for the administered drug. And we'll also keep a running tally of every time we administer medication. We can also record wastes into the same report, which can be embedded into the op report, and we can also use this to pull records and reports from. Scrolling back up, this is how the vitals monitor will work in terms of the integration. And then when the doctor is in room, we can select that tab, and that will give a timestamp for when the doctor is in room. When they start the anesthesia, when they start the IV, and ultimately we'll do a timeout to start the procedure, perhaps put in a throat pack. Once we have completed procedure, we simply just reverse the step, and it will give us the timestamp for the opposite. Once we stop the anesthesia, it will also calculate the total time under anesthesia. And once we're ready to discharge the patient, we'll pull out the vitals and ultimately discharge. With the end result looking like this. Standard format, standard template. Everything is expected to be there. And it's clean, it's easy to read, and it's easy to identify any kind of missing information if there is any with just a quick glance. So hopefully everyone would finds this webinar useful. Happy to go through any questions if there is any.
Yes, we do have a few. Someone asked, do you have to purchase AI from DSN?
Yes, it is an add-on module for our cloud users. Yes, so short answer is yes, you do.
Well, you don't have to. You can.
You don't have exactly. You don't have to. It is optional. It is a tool, but it is an optional extra.
Great. A few more questions are starting to pop in. One is, what metrics should practices track to know if standardization is working?
A few simple ones I would first say. First would be time to complete notes. If standardization is working, charting time should drop, especially if you do it after hours. Second is billing lag and rework. So how often the billing has to come back to the clinical team for clarification, and how long the claim sits before going out. Third can be the note completeness. They require fields being consistently captured across all the providers. And then finally, I would say variance between providers. When notes start to look more consistent, that's usually a sign that the system is doing its job. You don't really need any fancy analytics, just fewer questions, fewer delays, and faster turnaround.
Yeah, that makes sense. Someone else asked, will AI features be rolled out to server-based users?
This may be perhaps a question for Crystal. However, from what I understand, perhaps in the future, but I can't see it. Well, actually, I'll let Crystal answer if she's here.
Yep. Hi, everyone. Actually, the AI is specifically currently designed for our cloud customers. So at this time, it is not roadmapped for V30 products, it's exclusively currently for the cloud.
Great. Another question is around staff turnover. So Eric, I guess question is, how can standardization help with staff turnover or sort of help improve when staff turnover does happen?
So when notes follow a consistent structure, new staff don't have to learn, different charting styles or guess where information lives. It essentially will shorten the training time because it will reduce mistakes, keeps things moving when someone leaves unexpectedly. So in other words, a practice becomes less dependent on specific people and more resilient overall because they have a SOP, if you will.
Yep, makes sense. Another question just came in. Is there another way to add patient vitals from anesthesia to the charts?
You can scan the anesthesia tape in, or you can enter the readings in manually. But usually, what I find is the integration is definitely the easiest way of doing so.
Understood. Another question. Someone asked, how do you plan on eliminating the number of clicks between the charting sections?
Oof, that's a tough one because that sounds like a rework of certain things. I know AI will definitely help with that. Crystal, would you have any insight at all?
I do. Definitely AI is the route, especially as Eric explained before, by having the doctor to be able, or any of the clinicians to be able to have that microphone on and just have their continuous conversations or dictate as you would through a dictation system, it will automatically apply it in those specific fields throughout the clinical notes. So the time efficiencies there is wonderful. But in addition to, DSN continuously makes improvements every sprint that we deliver each month in our enhancements, both on the UI and the AI, both. And so I think that continuous improvements to make the workflow more consistent and continuity for you is the goal that we are aiming for. But the AI is going to be help first and foremost.
Um, Another question related to AI. Do the notes need to be blank to use the AI, or will it work with what's in there already?
It will work with what's in there already. You don't have to stick to just one method of input. You can mix and match, whether it's clicking, template, and AI. You can use it all at the same time. It will just build on top of each other.
Awesome. Let's do one more unless a bunch more happen to come in, but um this one makes sense. What, in your experience, Eric, documentation gaps tend to present the biggest risk from a compliance standpoint?
It's not really some big stuff. Mostly it's missing details. So things like incomplete procedure descriptions, missing anesthesia, sedation details, unclear medical necessities, things like that. Um, Notes that don't clearly support the codes being built are one of the ones that I see. One of another big one is inconsistency. So if two surgeons document the same procedure in completely different ways, that can create a risk during audits. So the idea is standardization will help by making each of the critical elements always being captured every time without relying on an individual or memory.
Yeah, that is a good answer. Um, I think that is it. So let's call it there. We will be sending around a recording of this webinar. So if you happen to miss anything or want to share it with anyone, we'll be posting it on YouTube and sending the link around to anyone who registered. Um, if you want to get in contact with DSN, feel free to reach out through our website. We also monitor, the emails we do email you from, so you can just reply to one of our emails and we'll see that. Really appreciate you all joining this evening. Um, Eric, if there's anything else you wanna say, um,
I'll get the floor for the last word.
uh,
Well, thanks everyone for the evening. Have a wonderful holiday, and hopefully we
yes,
get to chat soon.
yes. Thank you, everyone.
Thank you all.